Well, in this week's Cardiology News, we have news from several of the cardiology communities on Cardiosource, one from the biomarker and launching of the Anticoagulation Community, and a very interesting analysis of aortic stenosis with preserved ejection fraction. So to begin with, we have a study that looked at two of the novel biomarkers in heart failure, Galectin-3 and ST2, which are both markers linked to myocardial fibrosis and remodeling. And so there's a study done in 876 patients with about 5-year follow-up overall of an ambulatory heart failure population, the mean ejection fraction 34%. And they looked at NT-proBNP as a basic marker of risk, as well as other risk factors of age and ejection fraction, et cetera, and added Galectin-3 and ST2 into the models. Each individually was linked to endpoints such as total mortality and rehospitalization for heart failure. But when put in a multivariate analysis, only the ST2 remained in the multivariate model that included NT-proBNP. This did improve the C statistic and reclassification, and as such looks like it holds up in this real-world cohort. And so ST2 looks very promising in this data set, where both looked reasonable, but ST2 in particular. Next up, wanted to call attention to a second community that has launched under the direction of Bob Giuliano, a close colleague. And he is working with a whole host of folks in the field to develop an anticoagulation community that's one of the hottest areas in cardiology today. In the communities, we have all of the news, and so we've covered risk score analysis of the has bled for risk of bleeding prediction, correlation of the CHADS and the CHADS-VASc risk scores, information on the new anticoagulants, but also different formats. So he calls out an article of the month where they go in depth into the details. We also have videos of many of the news stories that come through, a case challenge that's always interesting with quizzes and other hot topics that emerge. And so be sure to check out the Anticoagulation Community. And one of the other top picks in the news this week is an analysis from the Mayo Clinic at patients with aortic stenosis, graded as severe, and the calculated valve area of less than 1.0 centimeters squared as the valve area on echo. They had 1,700 patients that they followed for several years and looked at the risk predictors based on two measures in the echo, the stroke volume as a flow metric and the measured gradient, the mean gradient, and split that by greater than or less than 35 milliliters per meter squared as the flow of low or normal. And then the gradient they split at a mean gradient of 40 millimeters of mercury. And all these patients had preserved ejection fraction, so the question is when to intervene. And so the low flow, low gradient cohort, despite the preserved ejection fraction, was a very high risk group that had adverse survival, a high risk of heart failure and atrial fibrillation, and in an observational fashion, those who had AVR had a lower survival, and so suggesting benefit there. In those who had normal flow but a low measured gradient, they seemed to do just as well with medical management and had a more favorable prognosis. And so some novel observations from a large cohort on a group that we may be able to observe for a longer period of time as opposed to rushing quickly to AVR. So for this week's Cardiology News, I'm Chris Cannon.